We're now connected with Dr. Arief Gazali, an obstetrician, gynecologist at the Hospital right here in Jakarta. Good evening, doctor. Thank you
Hello,
so
good
much, Dr. Arief.
evening. Thank you so
Thank
much
you.
for having me.
I know. Thank you so
Hello.
much for sparing your time here with us, doctor, as
Yes,
we
of
would
course.
like to get more insights about PCOS.
Okay.
Let's get right into it, doctor. There are a few
Okay.
factors that affect fertility in women. Can one of them be PCOS? And can you tell us more and enlighten us more about this, doctor?
Okay. We're talking about the PCOS. Basically, uh, female with PCOS has 8 times higher risk for fertility. Why? Because in PCOS, what happened is uh, the eggs is failed to mature, so there will be no ovulation. Uh, Pregnancy only happen if there are
Right.
cyclic ovulation each month. If there are normal cycle every month, women, we can say there are 95% there will be pregnancy rate. But in PCOS, there are disturbance in cycle. So that's why uh, the risk for infertility are also high.
What is actually the medical condition that you can see as symptoms of PCOS, doctor? Other than late periods, excessive hair growth, one of it, as I know, is obesity. Does this indicate that you have PCOS, doctor?
Okay. This one is what you've been said is right. It's really true. There are your miss cycle, there are excessive hair growth, and also there are signs from ultrasound that we see in ovary. We have many follicles, many little cystic appearance that
Right.
more than 10 follicles usually. And but the tricky is PCOS only happen from 7 to 10% of all women in reproductive age. Why? Because not all the disturbance in cycle is PCOS. First, if we found a women, a patient, as you said before, we cannot judge its PCOS right away. We have to
Correct.
uh, check a little bit more. Like anopheles disorder, not only PCOS, we have also have to check: is there any chance? Is there uh, disturbance from stress? Is there any chance from others? Like we have to see: is there any thyroid problem? So in PCOS, um, what we do, we cannot see from the only the cycle, but we have to see all of the problem in the women itself. Because in the PCOS, it's basically not only problem in the reproductive, but it's the problem in the whole uh, women's itself. It's also affecting the uh, 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 psychologist, is also affecting the
Right.
metabolic state.
Right. So, Dr. Arif, like, how young can you can find out that you got polycystic ovarian syndrome, like you said, because you can't really see someone, let's say, that's obese or have irregular, menstrual cycle, that you say that they got PCOS, correct? So, from like
Yes.
how young of age that you can determine that that person has a PCOS, and is there any treatment or a cure for it, doctor?
Okay. Basically, PCOS can affect all the phase of in women's life. In women, we know there are premenstrual state, there are reproductive age state, pre-menopause and post-menopause. Usually, PCOS, the women realize they have PCOS usually during the reproductive age when they want to conceive. Why can I get pregnant? And then they go to the gynecologist and we found their PCOS. Basically, PCOS not only affect the reproductive, as I said before, it affecting the whole thing. Like in the reproductive age, like adolescents, usually they make irregularity in the cycle. And in the pre-menopause, usually above 35 or above 40, uh, it appear in others. Moreover, it appears like the complication of the PCOS itself, like metabolic syndrome. like there's a risk for endometrial cancer. Aside from the problem in the reproductive age, yes, in the reproductive age we have the problem of infertility. Infertility in PCOS, yeah, it is rising 8 times, as I said before.
Right. Yeah.
But yes.
Sorry, doctor. I just need to, for you to enlighten this. Is this because of a lifestyle, doc, or PCOS because of hereditary?
Okay, there are many risk factors for the PCOS. First, lifestyle is the most is the biggest risk factor for the PCOS. And yes, recently in our hospital, we're not treating PCOS as a disease. We're treating PCOS as a lifestyle first. And from our study, we found that also PCOS also have genes that makes women it's more prone to have PCOS. Usually, it's the gene that regulates the metabolic carbohydrate metabolism, and also there are other genes also. So right now, if we see PCOS, we cannot see it as a disease, but we have to see as the whole thing what happened in the women itself.
Right. Especially if you're saying this is a lifestyle, so hopefully
Yes.
for women out there that is watching this and watching our talk show and discussion tonight, that we're more self-aware of our lifestyle and what we eat and how we do our daily activities, because this is something that I'm pretty sure that we can avoid, right, doctor?
Yes, of course,
Thank you. Yes, doctor, go ahead, please.
Yes. So right now, if we found PCOS is how we treat it. It's not only by giving a hormonal or by giving ovarian stimulating medicine to help them to conceive, but we have approach of lifestyle medicine first, because women with PCOS, when they're conceived, they also have many complications during pregnancy. So we have to be aware, because the PCOS, the problem is not in the eggs, but the problem is in the body, in the metabolic state. What kind of lifestyle medicine that we use? We use, usually if you go to the doctor, the doctor will say, please manage your stress. Please go to the gym or do exercise or eat healthy food. Okay, right now we're getting serious with that. Can you relieve your stress? If you have problem with your psychic area, you have to psychiatrist. And if you have, if you ask me about how to do sport, basically I'm gynecologist. I'm not quite good in sports, but we have the sports specialist also to deal with it, and also for the nutrition. So our approach for PCOS in our hospital is teamwork based.
Yes. So many helps and support from external factors too, indeed, Dr. Arief.
Yes.
So thank you, Dr. Arief. We apologize. We wish that we have more time about this, but of course we will have more further discussion with you in the future.
I'm very sorry for this connection problem.
No, it is great, Doctor. Thank you so much for your enlightenment on polycystic ovarian syndrome, and hopefully we will see you again very soon in other discussion with you, Dr. Arief Gazali. Thank you so much, and have a great evening, Doctor. Stay safe.
Okay, good night.